You're standing at the hospital doors, car seat in hand, baby bundled up and ready to go, and suddenly it hits you. They're really letting you take this tiny human home. Now what do I do? Hey there, I'm Dr. Leslie Treece, a pediatrician with over 25 years of experience, and today I'm walking you through the top 10 most important things you need to know before leaving the hospital with your newborn. These aren't just textbook tips, they're real world insights that I've gathered from helping thousands of families navigate those first overwhelming days. Some of these will surprise you, like why a single degree of temperature can be a full blown emergency in a newborn, or how one well intentioned kiss could change everything. So, whether you're a first time parent or just looking to feel a little more prepared, stick with me. I promise by the end, you'll walk away more confident and calm. And make sure you watch till the end for a bonus tip, an exclusive discount for my newborn prep course designed to guide you step by step through these crucial first weeks. All right, ready? Let's jump in. The very first thing you need to know, and trust me, it's a big one, fed is best. Let's talk feeding because nothing stresses out new parents faster. You've probably heard the phrase breast is best, and I absolutely support breastfeeding and encourage my new moms to breastfeed. Here's the truth that I've seen over and over in my 20 plus years as a pediatrician. Fed is best. Here's what many parents don't realize. Breast milk doesn't come in right away. It can take anywhere from 2 to 5 days after birth. And during that time, babies rely on small amounts of colostrum. For the most part, that's enough and that's totally fine. But I've seen far too many newborns come into my office dehydrated, fussy, losing weight simply because their parents didn't know what to look for or they felt guilty for even considering supplementing. If your baby seems frantic, overly sleepy, not producing wet diapers, or just plain miserable, don't wait. You can offer a small supplement like donor milk or formula, using a syringe or spoon to avoid nipple confusion. It won't ruin your breastfeeding. In fact, it can help your baby stay hydrated, latch better next time, and give your body the time it needs to get milk production going. So give breastfeeding your best shot, but don't let guilt get in the way of a thriving, well-fed baby. Temperature instability in newborns is a true emergency. Unlike older kids, babies under about 2 to 3 months of age can't regulate their body temperature well. And a slight fever or a dip can signal something very serious. So what counts as a problem? If your baby's rectal temperature is above 100.4 degrees, that's a fever. If it's below 97 degrees, that's considered hypothermia. Either one needs immediate medical evaluation. Don't wait it out. And yes, rectal temperature is the gold standard. I know it feels intimidating, but under the arm readings just aren't accurate enough in newborns when you're trying to catch early signs of illness. Why is this important? Because newborn immune systems are incredibly immature, and they're essentially like a cancer patient's immune system that's on chemotherapy. A high or a low temperature can be the first clue of a blood infection, brain infection, or other serious illness. These infections can progress rapidly and require immediate treatment, often with hospitalization. Some parents worry they'll, quote, overreact, but I promise with newborns, it's always better to call your pediatrician and to be told that it's okay than to wait and wish you had it. Also, make sure your baby's dressed appropriately for your environment. So, as a rule of thumb, one more layer than what you're wearing, and that's a thin layer. Not too hot, not too cold. And always feel their chest or back. Hands and feet can be cold even when the core temperature is fine. Bottom line, track your baby's temperature and trust your instincts. Never hesitate to seek help. This isn't alarmist. It's life-saving knowledge that every parent deserves to have. Let's move on to vaccines, specifically the hepatitis B that's offered right in the hospital. Now, I know some parents hesitate when this one comes up. It's your baby's very first vaccine, and you may wonder why it's necessary so early. Hepatitis B is often a silent infection. A person can carry the virus without knowing it, including the mother, a family member, or even a visitor. Babies can be exposed through tiny amounts of blood, and their little immune systems are not equipped to fight it off. If they catch it, the infection can become chronic, leading to serious liver disease or even cancer later in life. That's why CDC and American Academy of Pediatrics recommend the first dose before you even leave the hospital. It's safe, effective, and one of the simplest ways to protect your baby from a lifelong illness. Next up, the vitamin K shot. It's one tiny injection that does one massively important thing. It prevents your baby from bleeding internally. Here's why it's necessary. Babies are born with really low levels of vitamin K in their body, which is essential for blood clotting, and they don't actually start making enough of it naturally for several months. Vitamin K comes from food sources, but it also comes from gut bacteria, which babies aren't colonized with yet. Without it, some newborns develop a dangerous condition called hemorrhagic disease of the newborn. This can cause internal bleeding, even bleeding in the brain. It's heartbreaking, especially because it's so preventable. A single vitamin K injection at birth gives your baby the protection they need until their body can take over. It's not a vaccine, and it's not something that overloads their system. It's just a simple safeguard against a rare but devastating complication. I always tell parents this is one of those no downside, all upside decisions. Just say yes to the shot. Number 5, this one might seem obvious, but it's often overlooked. Limit your visitors during those first few weeks at home. Yes, everyone wants to meet the baby. And yes, it's hard to say no. But newborns have incredibly vulnerable immune systems. Their bodies haven't built up any defenses yet, and even a mild cold in an adult can be dangerous for them. Every single person who kisses or holds your baby increases the risk of exposure to germs, especially during flu, RSV, or COVID seasons, but really all year round. I'd recommend keeping visits short, limiting who can hold the baby, and make sure everyone washes their hands thoroughly first. And don't be afraid to ask them when to stay away if they're even a little bit sick. It's also totally okay to ask about their immunization status, especially for vaccines like Tdap, which protects against whooping cough. Adults can carry that illness without realizing, and it can be life-threatening for newborns. Most friends and family will understand this is not about being rude. It's about protecting your baby when they're at their most fragile. You can always take more pictures and introduce them later, but right now, less is more. Number 6, let's talk about something that's easy to overlook, but potentially life-threatening, and that's herpes virus. Herpes simplex virus, to be more specific, or HSV. Most people associate it with cold sores, and many don't even realize they have had it. Like, they had it as a baby, and had an outbreak with it, and have a cold sore occasionally, but they don't realize that they actually carry it. So, for a newborn, exposure to HSV, even without visible symptoms in the person who exposed them, can be devastating. So here's how it happens. A well-meaning relative or friend kisses your baby. They feel fine. No active cold sore in sight, no symptoms. But they're shedding the virus, and your baby's immune system can't fight it off. The result, HSV can cause a serious brain infection called encephalitis. It's rare, but when it happens, the consequences can be lifelong or worse. And that's why I always recommend a firm loving boundary, no kissing the baby at all at first. Those first 30 days are pretty crucial, not by grandparents, not by friends, not even by mom and dad if there's a history of cold sores. If you're unsure, talk to your OB about getting tested for HSV. It's a simple blood test that can give you some peace of mind. I know it feels like overkill, but I've seen what this virus can do to a newborn, and this is one of those times when a little caution goes a very long way. Next on the list, let's talk about umbilical cord care. That little stump might not look like much, but keeping it clean and dry is crucial for preventing infection in the early days. After birth, the cord is clamped and cut, leaving a small stump. It usually falls off within 1 to 3 weeks, but during that time, you might want to keep it exposed to air and as dry as possible. Fold the diaper down to avoid rubbing against it, and keep it beneath the cord so that the cord's constantly exposed to air. And skip the alcohol swabs unless your doctor specifically recommends them. If you see a little dried blood or clear fluid, that's okay, but call your pediatrician if there's a yellow pus, a foul smell, swelling, or redness around the base. Those could be signs of infection. Stick to sponge baths until the stump falls off, and never try to pull it off early. Let nature do its thing. When it's ready, it will just fall off. Next up, let's talk about leaving the hospital. As you leave the hospital, your baby's going to take their very first car ride. So let's make sure it's a safe one. Hospitals won't let you go without a properly installed rear-facing infant car seat. But even with that requirement, there are a few things that many parents miss. For starters, bulky coats or snowsuits are a no-go. They compress in a crash and leave room for your baby to slip out of the harness or to move too much. Instead, dress your baby in snug layers and place a blanket over the straps after buckling. The harness should be snug with the chest clip at armpit level, not on the belly. And make sure that the seat's installed at the right angle so your baby's head doesn't slump forward, which can block their airway. If you're unsure about your installation, Many fire stations or hospitals offer free car seat checks, and it's a peace of mind you won't regret. Last, but definitely not least, your baby's sleep. Safe sleep saves lives, and it starts from night one. Newborns should always sleep on their backs on a firm, flat surface like a crib or bassinet that meets current safety standards. Avoid soft bedding, pillows, bumpers, or stuffed animals, anything that could increase the risk of suffocation or SIDS. Room sharing is recommended, but not bed sharing, and that's recommended for at least the first 6 months. It makes night feedings easier and reduces the risk of sleep-related deaths. If you choose to swaddle, make sure it's snug at the torso and loose at the hips, and always lay your baby on their back. Their arms can be in or arms can be out, just however the most comfortable is fine. If you're ever unsure about what's safe, your pediatrician can help guide you. Sleep might be hard to come by in those first few weeks, but safe sleep practices are one thing you can absolutely control. And I do recommend being extremely cautious while you're breastfeeding, not to go to sleep, like laying down with the baby to feed. If you're super exhausted, it would be easy to go to sleep. So that was a lot, but if you're still here, give yourself some serious credit. You're already doing what great parents do, learning, preparing, and showing up for your baby. We've covered 10 of the most important things to know before leaving the hospital, and how to feed safely, what temperatures in emergency, how to keep visitors from sharing germs, and why some shots and rules matter more than you might have realized. And if you found this helpful, I'd love to invite you to go even deeper with me in my newborn prep course. It's called Baby Ready. It's a step-by-step guide designed to help you feel calm, confident, and ready for every stage of newborn care and preparation. And as a thank you for watching, use the code YouTube20 for 20% off, and you'll find the link in the description below. Don't forget to like, subscribe, and share this with someone who's expecting.